Hello, I am Dr. Rajarshi Dutta, consultant internal medicine, and I will be talking about hypertension today. Uh, Understanding hypertension. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel, and this is what is called as blood pressure. Normally, in a healthy person, it rises and falls throughout the day, but when the blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, a persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure. One or more close family members with hypertension increases a person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increase fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another important factor is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That is why it's often called as silent killer. It puts people at risk for several diseases from cardiovascular problems to kidney failure, stroke, eye damage, and even blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether a person having high blood pressure or not. Generally, when the symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called a sphygmomanometer, commonly known as a blood pressure machine. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's understand what do these numbers actually mean. A healthy or normal pressure should be lower than 120 by 80 millimeter of mercury, or it can be also said as 120 over 80 millimeter mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure. That means the pressure in the blood vessels when the heart rests between beats. If blood pressure level is more than 140 by 90 millimeter mercury, then the person has hypertension. If a person has BP levels higher than this, then he or she might be at risk of developing serious heart disease. This risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, stopping smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, adherence to medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might totally avoid, delay, or reduce the need for medications. So let's take a look at the strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes a person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood vessel will be less and it will lower the blood pressure. In other case, as we are all aware, that age and weight gain are the two major risk factors for high BP. So if blood pressure is at a desirable level, that is less than 120 by 80 millimeter mercury, then exercise can help to prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High BP level can be reduced by doing regular structured exercises such as brisk walking, swimming, jogging, etc. Next comes healthy diet. Diet also plays an important role in controlling blood pressure. A diet with high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in the diet, limiting alcohol consumption. DASH stands for Dietary Approach to Stop Hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury. Reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve heart health and reduce blood pressure by about 5 to 6 millimeter mercury if you have high blood pressure. To decrease sodium in diet, you can consider tips like read food labels if possible, choose low sodium alternatives of the foods, eat fewer processed foods, only small amount of sodium occurs in natural foods, and most of the sodium is added during processing. Don't add salt. Just 1 level teaspoon of salt has 2300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Third point, quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your heart disease risk and improve overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring of their BP levels. Self-monitoring is important and it helps a person to measure BP at different times throughout the day and over a longer period of time. It also helps assist doctor to get a more complete picture of one person's blood pressure readings at different times. Further helps in better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure measures that occur during a clinical visit. And finally, stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. Apart from this, when you are on medicine, adherence to medicine is very important. A medicine to lower blood pressure may be recommended by your doctor if your blood pressure is consistently high, usually at or above 140 by 90. Adherence to the medicine, that is taking it regularly every day, is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyles can help us enjoy long, healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventing care. Thank you.